Hello, my name is Sandra Kimmel, and I would like to talk to you today about a gunshot victim coming into the operating room in surgery. I wanted to go through the special little details that are involved in saving someone's life due to a gunshot. It requires special skilled individuals working together as a team and the knowledge of labs and blood work such in order to save someone's life. I would like to go into the details briefly of what it is like for someone coming into surgery with a gunshot and what it takes to save their life. When a patient comes into surgery, they may arrive through airlifted helicopter, which they will come straight off the helicopter straight into surgery, or they may come from the emergency room and up to surgery. Either way, the surgery department is notified and we know that a level 1 trauma is coming in, and we prepare the room for a gunshot. There are several people that work together as a team that make this a success as possible. We have an anesthesiologist, which will intubate the patient if the patient has not already been intubated on the scene, which involves a tube going down their throat and allows for us to hook up a bamboo bag and we're able to breathe for them. I'm trying to make these terms and as easy to understand terms as I can because I know that not everyone has as much medical terminology. We also have a nurse anesthetist involved that assists with the anesthesiologist that monitors the various heart rate, breathing patterns, tidal volumes, the different levels that they need to evaluate in order to monitor a patient while they're under anesthesia. It's very critical when you have a gunshot coming in because they're losing blood and their body is going into various functions and you have to maintain to keep them alive. Also, you have your surgeon, which is a trauma surgeon prepared and ready for gunshots. You have residents that are also in training, but they are very knowledgeable in trauma. They work together with the team. You have a scrub technician, which has the instruments involved, and he'll have like a major tray and various utensils such as a blade on a scalpel and laps and various things on the table, and he or she is to know where everything is, so when the surgeon asks for anything they can hand it to them in just a second. It has to be very quick. And then you have your circulator, which is a registered nurse, which is what I am, which is like the manager of the operating room. You monitor everything that goes on. You're responsible for knowing when that patient comes in the room, getting that patient on the table, putting the safety belt on. We insert a Foley catheter, which monitors the urine output. We are responsible for prepping the patient, getting them ready for surgery, and putting a bovie pad on their whichever spot on the body that is able to have a place for a bovie pad, which is for cautery. It's like a grounding pad so that if they use cautery to stop bleeding in certain situations, it grounds them so they're not shocked and there's no burns anywhere. Also, the circulator is responsible for knowing the labs, also knowing the availability of the blood. She is the coordinator, he or she is the coordinator for making sure the nursing assistant, which assists in this teamwork as well, is responsible for going down and gathering the blood from the blood bank and bringing it up in a timely manner. The circulator is like the manager of the OR and makes sure everybody is functioning properly with whichever role that he or she has. Everybody has to work together as a team in order for everything to flow correctly to save a person's life. But everybody that I work with, we seem to have our roles down to a T, and everybody just knows their part and we work together, and it's like an orchestra. Everybody just works together and pulls together their part, and everything comes together, and it's a beautiful thing when it works. Not everyone is able to be saved from a gunshot because depending on how many organs are affected and how in depth it is and stuff like that, you're not always able to save a patient. However, knock on wood, I have never lost a gunshot victim as of yet, knock on wood. But I do know that if you take the proper steps and you have the blood availability and you are able to get the surgeon and the scrub tech and the residents in there as quick as possible, then they are able to do their job, stop the bleeding, then there are very good outcomes. So it just really requires a good team, good skilled team with knowledge of everything involved in the operating room. Scrub techs knowing their instruments, being able to give it to the doctor in a brief notice, and the circulator coordinating everything. Everybody has to stay calm, and no matter what the situation, what the blood loss, we just have to try to give back the blood as quick as we can. I have at one time with one patient, I actually had to get 140 units for this patient because as fast as we were putting the blood in, the blood was coming back out. And I'm glad to say that patient did live. But it's just a very important thing to have everything coming together, and very important for teamwork, skilled individuals in the operating room. And with the laboratory values, you have to know where your labs fall, what are the normal values, what's out of range, to kind of know what the body is going through at certain times. And of course the patient has had to be typed and screened, cross-matched for blood, which means they look at the blood type, evaluate it, and then we see what blood's compatible to be given back to that patient. And it's very important to have blood available. And when we have some situations that come in and you don't have time to find out what blood type they are, we have what's called emergency blood, which is O negative, and we give that to the patients. So in conclusion, I would just like to touch on that how important it is to have a skilled team available and that works together really well, knows their part and works together, knows the value of the labs. We know our blood availability, and the circulator is a very important part of the room. He or she is the one that has to coordinate everything. If you see something that needs to be done that's not being done, it's up to the circulator to make sure it's getting done. We are the patient advocate. No matter what the situation, the nurse is a patient advocate at all times. And it's such a wonderful feeling to save a person's life from a gunshot. It's a big adrenaline rush, and I love my job. And I would like to thank you for taking the time for viewing my speech, and I hope you have enjoyed it. It was just a brief summary of what goes on in the operating room when a gunshot comes into surgery. Thank you.